morning, everybody. My name is Mario. I'm a PhD student in computer engineering. This is Alona, a master's student in computer engineering, and we've been working with Sharon, our apper, a PhD student in clinical psychology, to work on myAlly.
So myAlly is an application that helps adolescents who have difficulties regulating their emotions and who tend to resort to more self-harm and suicidal behaviors during times of distress. So the main goal of this application is to help them to cope and find ways to cope better with those intense emotions. And we do this by applying the techniques of dialectical behavior therapy, also called as DBT.
Okay, so DBT treats people with suicidal tendencies against destructive self-harm behaviors. So how it does this is one subset of DBT introduces some skills that a user should learn to help cope with these behaviors, and these skills are divided into 4 modules.
So the first module is mindfulness. So it teaches patients how to pay attention and be aware of their body sensations and their inner experience without judging it. And the second module is distress tolerance. So it teaches patients how to tolerate impulsiveness, usually will lead to more self-harm and destructive behaviors. And the third module is emotion regulation, which teaches patients how to identify and work on vulnerabilities to negative emotions and how to increase more positive emotions. And the fourth module is interpersonal effectiveness. So it teaches patients how to build more effective relationship and better self-respect to increase.
So there's a lot of overlap between the different modules because the different skills can apply in different ways just depending on the situation. So there's a bunch of activities that will apply one or more of these different skills. So for our app, we modified these activities so that they're targeted towards adolescents. So here are some of the activities that we have in our application. And it's a little bit complicated because DBT was originally geared towards adults and we're targeting adolescents. So we have to be careful about how we modify these applications, these activities, so that it's properly targeted towards our target audience.
So myAlly is designed so that a lot of its components are easily accessible so that users can quickly cope with the situations they're dealing with. So 2 features that need to be easily accessible, as you can see on the slide here, are crisis and diary card. So crisis is a way for users to quickly de-escalate the situation that they're in, while the diary card allows them to track their emotions and urges over time. Additional features are available via navigation drawer on the left. So now let's demo our app so that we can see it in action and you guys can better understand what we've done.
So here's our main screen. You can see the 2 main sections of our app, crisis, diary card, and in the background we have some motivational quotes fading in and out. So the diary card has to be in front because basically teenagers usually don't fill it out, and it's pretty complicated. We've simplified it so that they only have to fill in 7 emotions rated from 0 to 5. And on the next screen, they fill out their urges. So alcohol, self-harm, and drugs. So if Mario had a craving for a tequila right now, he'd set it to 5 for alcohol. And next, then it'll record into a database and we can see the progress later on.
So the diary card is important for both the patient and the therapist. So for the user, it's important to be self-aware of your tendencies, of emotions and urges and behaviors. On the other hand, for the therapist, they could use this data to structure therapy sessions around these tendencies and patterns.
So we want a lot of the activities to be easily accessible, so we do this via a navigation drawer. And one of the activities that we have is thought diffusion. So you want these activities easily accessible because DBT is better when it's used on a daily basis. This way, when you actually come into a crisis, you're well practiced in these activities. So if we look, Alona is now punching in a thought into her thought diffusion. And what's going to happen is the cloud is going to drift away. And if Alona tries to push it out, it will actually bounce back.
So thought diffusion is an exercise, is a mindfulness exercise to help you to learn how to mindfully observe your thoughts come and go. So instead of pushing it away or trying to sort of get stuck in a thought, with practice, this skill will help you to be able to have the freedom to choose what thoughts to concentrate on and what thoughts that you could just let go by observing it just be.
So the next the next activity that we're going to show is the body scan, which also helps users reflect on their inner self. So myAlly will guide Mario through a body scan. It'll tell him to mindfully look at the different parts of his body, and then he can select if he feels tension in certain parts of his body, and it'll be highlighted as red.
So let's say here Mario highlighted that he feels some tension and fidgety in his hands. So this activity would then guide him to a muscle relaxation exercise. So he will be guided to flex his hands for 5 seconds as he breathes in. So you can see there's a balloon guiding him to breathe in as he flexes his hands and to relax as he breathes out. So this exercise, this is just a demo that just do it one time, but usually we do it several times with patients after they identify which are the parts of the body that they feel a lot of tension and discomfort. And this exercise will help them to learn how to voluntarily contract and relax the muscle so that they learn how to be calm themselves when they're during times of distress, or even as a daily practice to learn how to be more relaxed.
So the average person has about 50,000 thoughts running through their head during any given day. And we have this activity called Mind Jar, where these thoughts are represented as snowflakes or sparkles. And you can imagine that if you shake the phone, it's analogous to having these thoughts sort of shuffling in your head and clouding your judgment.
So this resulted in a clouded jar, or in this case, a clouded mind. So this activity teaches a learner during times of distress, instead of like responding while you're still in a distressed time, you slow down and wait until all this ice or snowflake to settle down.
And this takes time. So we can see they're starting to settle at the bottom, but we're trying to develop that it takes time for your thoughts to settle and for you to clear your mind.
So instead of reacting to what we call like an autopilot, especially when you're distressed, a lot of time you may respond negatively to those distress. You wait until the thoughts settle down so that you have a clear mind before you react to those situations.
So now the second part on our main screen is the crisis. And so when a user is in crisis, they can easily access this button. And on the very side, you can select the activity that you want to do when you're in crisis. So usually the user will, in therapy, they'll discuss it with their therapist and then figure out which one is most suitable for them. So in this case, we're going to showcase slow breathing. So
before the activity begins, Mario is asked to select what he's feeling right now.
I picked anxious. In case
And his heart rate is being measured. And then he'll be guided to do a slow breathing exercise where he'll be taking a slow, deep breath for 5 seconds and a slow breathing out for another 5 seconds. So just for the demonstration's sake, when he feels more calm, he could click the finish button and he'll be prompted to indicate his feeling again. And he'll be asked again to measure his heart rate. So this data will be used to track how Mario physiological response before the activity and after activity. So it gives him biofeedback right away after the activity, both immediately and over time, so he can know how effective each activities are in terms of helping him to feel more calm when he's feeling distressed.
So we're just going to quickly show you the community aspect. Yeah.
That's done.
This just quickly shows you the people around the world and how they're feeling at the time and their moods, and it basically gives people a sense of solidarity.
So real quick, future work or key learning was we should probably build peripheral components before we actually created the activities. This way all the activities feed into one thing so that we can incentivize the app for users.
And lastly, the ones that we have shown are the basic, commonly found, most useful DBT skills among adolescents, but there are a lot more that we would like to add, to expand on in the future, and possibly adding components that could increase or maintain that motivation to continue using the app, for example, through gamification. It will be important to field test with clinicians and patients who are doing DBT to see its efficacy in terms of improving the treatment outcomes and compliance. So that's it.
Thank you.
Really hitting heart rate measure, shaking the finger, does it give you an accurate measure, or do you have any filter to?
So long as the finger is over the camera, that's what's required in order for it to happen. So even if you're shaking, it shouldn't really change.
Conventional, whatever the heart rate measures are. So after a gym, if I use it, I'm not going to it gives me really strong.
Is that a question?
Yeah.
I can't help but notice that the app was very geared towards females. Was that done on purpose? I can't see a man using this.
That's actually a really neat question. So as I said, the DBT is actually, or the borderline personality disorder, that's actually a lot more, the majority of the patients are actually females. So I guess I wasn't thinking about it intentionally, but almost majority of my patients are actually females. So that's actually a good point. I didn't think about that, why I was doing that.
It's a really interesting app. I'm just curious what the research says in terms of similar kinds of apps you could use using visual stuff. Aside from you guys, like, is this proven? Is this form of kind of visual cues proven as a way to treat or help patients?
That's a very interesting question. So I was just having a clinical consultation meeting, like a clinical focus group yesterday with a lot of DBT clinicians to demonstrate this app. And they said something that's really unique about this app is exactly the visual cues. They have come across an app that do a lot of like audio guidance, but not really anything that do visual. And they see it very useful, especially for the adolescent population when they actually enjoy having that visual guidance. I think that's sort of both we will need to test the efficacy, as you said, as we haven't done it yet, but it will be sort of the niche of this app at the same time to have that visual cues.
So good. It's a good question.
And we will need to
You
test
don't
it.
actually know the answer, but
We'll
you
have
got a
to
good
test it.
reaction from clinicians. That's really interesting.
Mm-hmm.
Okay, thank you.
Thank you.